All India Radio presents Morning News. Good morning. I am Saira Mujtaba and with me is Sunil Verma. The headlines. Prime Minister Narendra Modi to chair Council of Ministers meeting this morning to review COVID-19 situation in the country. Health Ministry issues revised guidelines for home isolation of mild and asymptomatic COVID patients. Prices of Covaxin for state governments reduced from 600 to 400 rupees. More than 15 crore 21 lakh doses of COVID vaccine administered in the country so far. IRDAI asks insurers to settle COVID-related cashless insurance claims within 1 hour. Operations of Oxygen Express trains expanded to Haryana and Telangana. Uttar Pradesh government extends weekend curfew till Tuesday morning. Government procures over 258 lakh tons of wheat, benefiting more than 25 lakh farmers so far. And Delhi Capitals beat Kolkata Knight Riders by 7 wickets in IPL cricket. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for persons of ages between 18 and 44 would begin from 1st of May at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi will chair a meeting of Council of Ministers at 11 a.m. today to review the COVID-19 situation in the country. This will be the first meeting of the Council of Ministers in the aftermath of the second wave of the pandemic. During the meeting, the ongoing vaccination drive, which has now been opened for those in the 18 to 45 years age group, is likely to be discussed among others. The Health Secretary yesterday submitted a report to the Home Secretary regarding the COVID situation in the worst affected 9 states. Maharashtra, Kerala, Karnataka, Uttar Pradesh, Tamil Nadu, Delhi, Andhra Pradesh, West Bengal and Chhattisgarh are some of the worst affected states and major contributors to the sharp rise in COVID cases in the country. The Prime Minister has been holding a series of meetings with several stakeholders and key personnel to continuously review the COVID-19 situation in the country. He previously held meetings with chief ministers of states, vaccine manufacturers, top brass of the pharmaceutical industry, discussing various aspects of how to bring COVID-19 under control. The Prime Minister also held a meeting with oxygen manufacturers across the country to discuss the ramping up of oxygen generation and its transport amid the shortage of oxygen reported in several states. The vaccine manufacturers have been asked to ramp up their production as well as attract new national and international players. The manufacturers have been directed to release 50% of their stock for the state governments and in the open market at a pre-declared price. At present, 45 years and above are eligible to administer the COVID-19 vaccine, while the vaccination for 18 years and above will begin from 1st of May, as the registrations for the same have begun on CoWIN portal and Arogya Setu app.
Prime Minister Narendra Modi yesterday reviewed the Army's preparedness and initiatives to deal with the COVID-19 situation in the country. The Prime Minister and Chief of Army Staff, General M.M. Naravane, discussed various initiatives being taken by the Army to help in COVID management. General M.M. Naravane informed the Prime Minister that medical staff of the Army is being made available to the various state governments. He added that the Army is setting up temporary hospitals in various parts of the country. General Naravane apprised the Prime Minister that the Army is opening up its hospitals for civilians. He informed that the Army is helping with manpower for imported oxygen tankers and vehicles where specialized skills are required to manage them. The Centre has said that the national directives for COVID-19 management will continue to be strictly followed throughout the country till 31st of May this year. The Ministry of Home Affairs has directed all states and union territories to consider containment measures for immediate implementation based on the assessment of the situation. It has asked them to implement the necessary containment measures under the relevant provisions of the Disaster Management Act. Earlier in its advisory, the Ministry of Health and Family Welfare had asked the states and UTs to identify districts where either the test's positivity had been more than 10% or bed occupancy was more than 60%. The ministry had said that the districts fulfilling any of the two criteria should be considered for taking intensive and local containment measures. The Union Health Ministry has issued revised guidelines for home isolation of mild and asymptomatic COVID-19 cases. As per the guidelines, the patients who are clinically assigned to be mild or asymptomatic are recommended for home isolation. As per the guidelines for home isolation, the patient should be clinically assigned as mild or asymptomatic case by the treating medical officer, and such cases should have the requisite facility at their residence for self-isolation and for quarantining the family contacts. A report.
According to the revised guidelines, the Health Ministry has said the patient must isolate himself from other household members, stay in the identified room and away from other people in home, especially elderlies and those with comorbid conditions. The patient should be kept in a well-ventilated room with cross-ventilation. Patient should at all times use triple-layer medical mask. The patient has been advised self-monitoring of blood oxygen saturation and health and must be in communication with a treating physician and promptly report in case of any deterioration. The decision to administer remdesivir or any other investigational therapy must be taken by a medical professional and administered only in a hospital setting. As per the guidelines, patient under home isolation will stand discharged and end isolation after at least 10 days have passed from onset of symptoms or from date of sampling for asymptomatic cases and no fever for 3 days. The ministry said there is no need for testing after the home isolation period is over. With Anand Kumar, Suparna Saikia, AIR News, Delhi.
The Union Health Ministry has also come out with a protocol for management of COVID-19 in the pediatric age group. The ministry said children with COVID-19 infection may be asymptomatic, mildly symptomatic, moderately sick or have severe illness. As per the protocol, asymptomatic children are usually identified while screening if family members are identified. Such children do not require any treatment except monitoring for development of symptoms and subsequent treatment according to assessed severity. It said children with mild disease may have sore throat, rhinorrhea, cough with no breathing difficulty, and a few children may have gastrointestinal symptoms as well. It said such children do not need any investigations. As per the protocol, these children can be managed at home with home isolation and symptomatic treatment. There should be regular communication with the doctor or healthcare worker. India has administered over 15 crore 21 lakh doses of COVID-19 vaccine in the country so far. These include over 93 lakh 85,000 healthcare workers who have taken the first dose and more than 61 lakh healthcare workers who have taken the second dose. Over 1 crore 24 lakh frontline workers who have taken the first dose and more than 67 lakh frontline workers who have taken the second dose. India had launched the world's largest vaccination drive on 16 January this year. The Union Health Ministry said that more than 20 lakh 84,000 beneficiaries were inoculated with COVID-19 vaccine doses till 8 p.m. yesterday, out of which around 12 lakh beneficiaries were vaccinated with the first dose and more than 9 lakh beneficiaries received the second dose of the vaccine. The total registrations on CoWIN portal for Phase 3 vaccination has crossed 2 crore 28 lakh in just 2 days.
Bharat Biotech has reduced the cost of Covaxin vaccine for state governments. It will now cost 400 rupees per dose for state governments instead of earlier announced price of 600 rupees per dose. Bharat Biotech has said that the decision has been taken recognizing enormous challenges being faced by the public healthcare system. The Covaxin will cost 1,200 rupees per dose for private hospitals. The price of vaccine for export is $15 to $20. Earlier, the price of Covishield vaccine for states was also reduced from 400 to 300 rupees. The government has expedited the process of import of critical medical devices amid growing demands due to COVID-19 pandemic situation in the country. In this connection, the Union government has permitted importers to import 17 medical devices required to provide relief to the COVID patients. An order issued by the Department of Consumer Affairs will remain in force for 3 months. The permission has been granted for the import of nebulizers, oxygen concentrators, CPAP and BiPAP devices, vacuum pressure swing absorption, pressure swing adsorption, oxygen plants and cryogenic oxygen air separation units. In addition to these, permission has also been given to import oxygen canisters, oxygen filling systems and oxygen cylinders, including cryogenic cylinders and ventilators, among others. The department has directed that the importers shall inform about all such imports to the officials of the state where the equipment will be imported.
Insurance regulator IRDAI has directed insurers to approve COVID-related cashless claims within 60 minutes of receiving appropriate documents from the claimant. IRDAI announced the new rules after Delhi High Court directed it to inform insurers to hasten the process of cashless claims so that hospital beds can be freed quickly for new patients. IRDAI also said that the decision on authorization for cashless treatment for COVID-19 claims shall be communicated to hospital within a period of 60 minutes from the time of receipt of authorization request. The decision on the final discharge of patients covered in COVID-19 claims shall be communicated to the network provider within a period of 1 hour from the time of receipt of the final bill, along with all necessary requirements from the hospital. It was earlier reported that network hospitals are turning back COVID patients with cashless insurance. Civil Aviation Minister Hardeep Singh Puri has said that 600 oxygen concentrators from the US have arrived at the Delhi airport. An oxygen concentrator is a medical device that concentrates oxygen from ambient air. Spice Express, the air cargo arm of SpiceJet, had on Wednesday airlifted 1,000 oxygen concentrators from Hong Kong to Delhi. In the last 2 weeks, more than 2,000 oxygen concentrators have been airlifted by SpiceJet for Spice Health. Earlier in the day, the minister had informed that the first consignment of oxygen concentrators arrived from Germany on an Air India flight.
Operations of Oxygen Express trains have been expanded to Haryana and Telangana after Maharashtra, Uttar Pradesh, Madhya Pradesh and Delhi. Continuing the momentum, there are 3 more trains on the run, either carrying liquid oxygen or on the way to the loading plants. It is expected that cumulative liquid medical oxygen, LMO, carried by Indian Railways will reach almost 640 metric tons in the next 24 hours. Haryana will receive its first Oxygen Express as a train with 2 tankers from Angul in Odisha. The continuous stream of oxygen trains to Haryana will ensure oxygen replenishment to the COVID-19 patients in the state. Telangana government has also requested Indian Railways for Oxygen Express. An empty rake is on its way from Sikandarabad to Angul with 5 empty tankers and is expected to reach Angul today. Uttar Pradesh received its Oxygen Express number 5 carrying 76.29 metric tons of LMO yesterday in 5 tankers. 1 tanker was offloaded in Varanasi while the remaining 4 tankers were offloaded in Lucknow. Train number 6 is already on its way to Lucknow and is expected to arrive today carrying 33.18 metric tons LMO in 4 tankers. Railways is in full preparedness for providing oxygen transportation services to all the states in need. In the ongoing operation, states provide tankers to the railways. Railways then proceed in the fastest feasible mode to bring the oxygen supplies from the locations and delivers it to the requisitioning states. The deployment and use of this oxygen is done by the state government. You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi to chair Council of Ministers meeting this morning to review COVID-19 situation in the country. Health Ministry issues revised guidelines for home isolation of mild and asymptomatic COVID patients. Prices of Covaxin for state governments reduced from 600 to 400 rupees. More than 15 crore 21 lakh doses of COVID vaccine administered in the country so far. IRDAI asks insurers to settle COVID-related cashless insurance claims within 1 hour. Operations of Oxygen Express trains expanded to Haryana and Telangana. Uttar Pradesh government extends weekend curfew till Tuesday morning. Government procures over 258 lakh tons of wheat, benefiting more than 25 lakh farmers so far, and Delhi Capitals beat Kolkata Knight Riders by 7 wickets in IPL cricket. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back. You're listening to Morning News. A total of 24,235 new confirmed cases of coronavirus infection were reported in the national capital in the last 24 hours, taking the total number of cases to over 11,22,000. The Delhi government has said that over 10 lakh people affected with coronavirus have been cured so far. In the last 24 hours, 25,613 people recovered and 395 deaths were reported in the city. The death toll so far in the national capital stood at 15,772. Presently, the total number of active cases of COVID-19 in the national capital is 97,977. More than 31,761 beneficiaries were vaccinated with COVID-19 vaccine doses in the last 24 hours in Delhi. With this, more than 31 lakh vaccine doses have been administered to date. The Uttar Pradesh government has decided to extend the curfew for one more day on the weekend in the state. The curfew in the state will continue on Monday also, apart from Saturday and Sunday. It will now start from 8 p.m. in the evening tomorrow and will end at 7 a.m. on Tuesday morning. In another important development, doctors practicing Ayush will also help in the fight against coronavirus in the state. The number of such doctors in the state is around 5,000. On the other hand, Chief Minister Yogi Adityanath has directed officials to increase around 33,000 COVID beds in the state. These beds will be of L1, L2 and L3 categories. After reviewing the COVID-19 situation in the state, the Chief Minister has asked the Health Department to increase 15,000 beds and Medical Education Department to increase 18,000 beds for COVID patients immediately. To augment the upcoming vaccination drive from 1st of May, the Uttar Pradesh government has decided to invite global tenders for vaccination. The state government has already placed an order of 1 crore vaccines for the vaccination of people of above 18 years of age in the state. Uttar Pradesh has become the first state to invite global tenders for vaccination to every citizen of the state who is above 18 years of age. There are an estimated 9 crore people who are above the age of 18 years in the state.
Odisha government has asked the 2 vaccine manufacturers for immediate supply of COVID-19 vaccines to roll out the vaccination of people aged between 18 and 45 years from tomorrow. Accordingly, it has projected the need of 40 lakh Covishield doses for May to the Serum Institute of India, with subsequent doses of 60 lakh each for June, July and August. Similarly, it has asked Bharat Biotech to supply 10.34 lakh doses of Covaxin in 2 phases. More from our Bhubaneswar correspondent.
At least about 4 lakh people of the state in the age group of 18 to 44 years have already registered themselves for COVID-19 vaccination scheduled to begin from tomorrow. The rollout of the 3rd phase of the vaccination, however, depends on the availability of the vaccine, for which the state government is already in touch with the vaccine manufacturers. The Odisha police has gone into an overdrive to enforce COVID-19 protocols across the state, with the police having already fined an amount of 5 crore 24 lakh rupees from mask violators alone during this month only. COVID-19 active case load has further jumped to about 58,000, with nearly 7,000 new positive cases detected during the last 24 hours. Girish Chandradas, AIR News, Bhubaneswar.
In Bihar, fresh COVID cases continue to rise rapidly. A record number of 13,089 fresh cases were reported in the state yesterday. 155 deaths were also reported. With this, casualties due to the pandemic have gone up to 2,480. Positivity rate has gone over 13%. Maximum positive cases of 2,186 were reported from Patna, followed by 1,128 in Gaya. Active cases have crossed 1 lakh. Over 3,52,000 patients have recovered from infection so far. 87,188 people took vaccine yesterday. Over 70,53,347 people have been vaccinated till date in the state. Madhya Pradesh Chief Minister Shivraj Singh Chauhan is informed that in the month of April itself, the availability of oxygen in the state has increased 5 times. The corona positivity rate of the state is declining continuously. The state's weekly average positivity rate is 22.7%. More from our Bhopal correspondent.
Madhya Pradesh on Thursday reported 12,762 new cases, while 13,363 patients were recovered from infection. The death of 95 patients increased the fatality count to 5,519. There are 92,077 active COVID-19 cases in the state at present. The number of active patients had increased to more than 94,000, which has now decreased. Meanwhile, Chief Minister Shivraj Singh Chauhan said that the availability of oxygen is continuously increasing. Pooja P. Vardhan, AIR News, Bhopal.
The Gujarat government has increased its order for vaccines from earlier 1 crore 50 lakh doses to 2 crore 50 lakh doses. Chief Minister Vijay Rupani announced this through his social media address yesterday. He said that people above the age of 18 years will get free vaccination in government vaccination centres. He said that the state government has set up about 6,000 vaccination centres for smooth running of the new phase of vaccination. More details from our Ahmedabad correspondent.
Chief Minister Vijay Rupani has said that Gujarat has a stock of more than 7 lakh doses for the current vaccination drive for the people above 45 years. He said that the new phase of vaccination for the people above 18 years will start before 15th May after receiving the new stock of vaccines. Meanwhile, the state government has allowed all the MLAs to spend their grant of Rs 25 lakh to purchase the medical equipment for the government hospitals. The government offices will work with 50% staff till 15th May. 150 new ambulances have been handed over to the different districts of the state today. Similarly, 140 more doctors have joined duties at DRDO-run 900-bed Dhanvantari COVID Hospital in Ahmedabad. Yogesh Pandya, AIR News, Ahmedabad.
The Maharashtra government has extended the current COVID-19 restrictions till 15th of May. This decision has been taken because of a massive surge in both fresh cases and deaths in the state. More details from our Mumbai correspondent.
Maharashtra yesterday reported 66,159 new cases and 771 deaths. Chief Minister Uddhav Thackeray has issued an order and said the decision was imperative to continue the emergency measures to prevent and contain the spread of virus. Thackeray further instructed to all district collectors to be ready for third wave of COVID-19 and proper planning of medicines, oxygen plants, hospital fire audits, and said it should be actually appear to have been implemented. He said it is a need of hour to speed up vaccination process. Bhavna Gokhale, AIR News, Mumbai.
Tamil Nadu reported more than 17,000 fresh COVID cases and more than 100 deaths. Over 112,000 active cases were registered yesterday. A total of 15,542 people were discharged. Chennai registered 5,445 cases and 40 deaths. The state government has extended the night curfew and complete lockdown on Sundays until further orders. The curfew will be observed from 10 p.m. to 4 a.m. every day. The government has said that the procurement of wheat in Rabi marketing season 2021-22 is going on smoothly in states and union territories. The Consumer Affairs Ministry said over 258 lakh tons of wheat has been procured in the ongoing Rabi marketing season, benefiting over 25 lakh farmers. The procurement of wheat has recently commenced in Rabi marketing season in the states of Punjab, Haryana, Uttar Pradesh, Madhya Pradesh, Rajasthan, Uttarakhand, Chandigarh, Himachal Pradesh, Delhi, Gujarat and Jammu and Kashmir at minimum support price. Assam has planned to provide more than 20 lakh tap water connections in this financial year under Jal Jeevan Mission. Jal Shakti Ministry said Assam government presented their annual action plan for 2021-22 to the National Committee chaired by the Secretary, Department of Drinking Water and Sanitation through video conference. Assam has more than 63 lakh rural households, out of which 10.75% are getting tap water supply. The state has planned to achieve total saturation by the year 2024. The ministry said last year Assam had provided 4,76,000 tap connections in rural areas. Jal Jeevan Mission is a flagship program of the central government which aims to provide piped tap water in every rural household by 2024.
And in IPL cricket, Delhi Capitals beat Kolkata Knight Riders KKR by 7 wickets at the Narendra Modi Stadium in Ahmedabad last night. We have a report.
Prithvi Shaw's cracking 41-ball 82 helped Delhi Capitals power to a 7-wicket win over Kolkata Knight Riders in an Indian Premier League match at Ahmedabad's Narendra Modi Stadium last night. After 2 successive losses, Mumbai Indians finally turned the tide to beat Rajasthan Royals by 7 wickets in yesterday afternoon clash at Delhi's Arun Jaitley Stadium. Punjab Kings will have to play out of their skins to get their stuttering campaign back on track when they face a high-flying Royal Challengers Bangalore at Ahmedabad's Narendra Modi Stadium this evening. Virat Kohli-led RCB have won 5 of the 6 matches they have played. Bharat Ratna Sachin Tendulkar has donated ₹1 crore to procure oxygen concentrators for COVID-19 patients in the country amidst the second wave of the global pandemic. While IPL franchisee Rajasthan Royals has also pledged ₹7.5 crore towards the fight against pandemic through its philanthropic arm Royal Rajasthan Foundation and the British Asian Trust. Captain Dimuth Karunaratne scored a second consecutive test century while his opening partner Lahiru Thirimane was unbeaten on 131 as Sri Lanka matched 291 for 1 at stumps on day 1 of their second test against Bangladesh in Pallekele. In the other sports news, FC Goa were beaten 0-2 by Al-Wahda in their final AFC Champions League match at the Jawaharlal Nehru Stadium last night. FC Goa were without the services of all their foreign players as well as head coach Juan Ferrando and were forced to play the game with only Indian players. Goa finished third in Group E in their maiden appearance in the tournament. Indian shuttlers are likely to leave for Malaysia and Singapore via Doha to participate in the last 2 Olympic qualification events next month due to travel bans imposed by the 2 countries in the wake of unprecedented spike in COVID-19 cases in India. Former world number 1 Saina Nehwal and Kidambi Srikanth face a race against time to qualify for the Tokyo Games, especially after the India Open Super 500, which was to be held between May 11 to 16, was postponed. Indian shuttlers will have to reach Malaysia latest by May 10 because of the mandatory 14-day quarantine. Sports Desk, AIR News, Delhi.
And now let's take a look at the weather forecast. National capital Delhi will have a partly cloudy sky. Minimum temperature is expected at 23 degrees Celsius, while maximum would go up to 40 degrees. Mumbai will also have a partly cloudy sky. Minimum temperature will be around 26 and maximum will be 34 degrees Celsius. Chennai is also going to have a partly cloudy sky. The temperature will hover between 29 and 38 degrees Celsius. Kolkata will have a partly cloudy sky with possibility of development of thunder lightning. Minimum temperature was 27, while maximum is expected to be around 38 degrees Celsius. Jammu will have a mainly clear sky becoming partly cloudy towards the afternoon or evening. Temperature will hover between 23 and 40 degrees Celsius. Srinagar will have a generally cloudy sky with light rain. Leh will have a mainly clear sky, temperatures ranging between 3 and 17 degrees Celsius, while Gilgit will have a mainly clear sky and Muzaffarabad will have a mainly clear sky becoming partly cloudy towards the afternoon or evening.
And now an overview of today's newspapers. Corona-related stories continue to dominate front pages of most dailies. Bharat Biotech cuts Covaxin's price for states after SII move, writes Hindustan Times. Now Biotech cuts Covaxin rate by 200 rupees for states. The Tribune headlines, most in India support COVID jab certificate for international travel, says study. Times of India says, Army opens its hospitals to civilians. The paper also reports that Uttarakhand suspends Char Dham Yatra. In order to contain rising COVID cases in UP, the Pioneer headlines, UP extends weekend curfew till Tuesday morning. The paper also reports that Ayush 64, useful in treating mild to moderate COVID cases. And finally, Economic Times says, US directs 20 million doses of its AstraZeneca vaccine to India.
And now, before we end the bulletin, the headlines once again. Prime Minister Modi to chair Council of Ministers meeting this morning to review COVID-19 situation in the country. Health Ministry issues revised guidelines for home isolation of mild and asymptomatic COVID patients. Prices of Covaxin for state governments reduced from 600 to 400 rupees. More than 15 crore 21 lakh doses of COVID vaccine administered in the country so far. IRDAI asked insurers to settle COVID-related cashless insurance claims within 1 hour. Operations of Oxygen Express trains expanded to Haryana and Telangana. UP government extends weekend curfew till Tuesday morning. Government procures over 258 lakh tons of wheat benefiting more than 25 lakh farmers. And Delhi Capitals beat Kolkata Knight Riders by 7 wickets in IPL cricket. And with that we end the morning news. Have a great day.